Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. Have a couple of quick announcements before we introduce our guest for today. We have our December symposium coming up at the Microsoft Tech Center, and tickets for that are officially available, so make sure that you hop on and join. We also have our May symposium coming up at the end of this month as well, going to be another really great event. Make sure that you grab your tickets for that too. And with that, I would like to formally introduce today's guest, Michelle Hoy, who is the Vice President of Clinical Operations at Ellipsis Health. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Michelle during our conversation, please use either the Q&A feature or the chat, and I will make sure that we get to it. So with that, thank you so much, Michelle, for being here.
Thanks for having me.
So excited to kind of jump in. Maybe a great place to start for our listeners would be if you could just tell us a little bit more about yourself and your role at Ellipsis Health.
Sure. So I'm a mental health and substance use disorder therapist by training and have been an executive at behavioral health provider organizations. I was an early partner with Ellipsis Health, helping them find individuals who suffered with depression and anxiety to gather their voice samples and their data. And when I was considering a career move, I really wanted to be part of the shift that is starting to happen and definitely going to grow around how we identify, treat, think about, and react to mental health issues in this country. And so I chose Ellipsis to be part of because they're doing such innovative work. So I'm with them, heading up research and clinical work with our partners, helping think about how you use vocal biomarkers, which is what Ellipsis does. We have vocal biomarkers where we listen to a person and can give a depression or anxiety severity score, much like a PHQ or a GAD. But this is, I would say, much more democratized in that most people can speak. PHQs and GADs have reading issues, cultural, racial, ethnic issues that are not always accounted for, and can be done anywhere people are talking, which is in every doctor's office and every conversation with your insurance company, et cetera. So it's an easy way to start getting a mental health vital sign.
Wow, that's incredible. I'm so curious. I think one, the fact that you have been in this industry for so long, kind of as a provider, I would imagine has so informed the work that you do, currently at Ellipsis Health. But I'm just also so curious, in what other ways kind of have you seen your particular expertise, your experience kind of apply to, us in the startup space, still kind of within the same industry?
Yeah, it's been really interesting and a great journey. I think that it's been really great to bring a provider viewpoint to technology. I've gotten to learn a lot about technology, which has been great for me personally, and being able to help the tech teams and the folks who we're talking to really think about mental health differently, really thinking about why would we want to screen and identify for mental health? How does it affect a whole person, especially given that it's Women's Health Tech and it's Mental Health Month? Women in particular, I'm thinking of an example. We're working with a partner right now, and we have calls, and there's a mom who has come up positive for depression, and she just had a baby and has two other small children. And as this advocate is talking to this mom, the mom's saying, I'm fine, I'm just calling about the bill. And that's wonderful. And what new mom isn't saying that they're fine? They are tired and overworked and have a lot going on. And it's easy to chalk things up to that. And identifying that this mom might have depression and might actually benefit from some medication or some therapy, because we know that those things work, will benefit her and her children enormously. and pay off in the long run. So it's having those little small bits of conversation to help partners in our team and others really think about the value in identifying mental health issues.
Wow, that is so powerful. And I can, only imagine, I continue to imagine how a proactive approach like this is probably, so impactful, both for, patients, the people, but also for like the broader ecosystem as well. So I think that's
Yeah,
amazing.
we think a lot at Ellipsis about whole person care and total cost of care. I've been a big believer in the quadruple aim for a long time and thinking about, if somebody has depression and they just had a major medical event, they are a new mom, their husband just had a heart attack. These are the kinds of things that happen to women, right? And when we don't take care of ourselves, it's harder to take care of others. And we know that depression affects people's energy, ability to think clearly, be able to be proactive and organized. So it's harder to follow through on care plans and making all the changes that are so necessary to manage medical issues. So we think a lot about whole person care, reducing total cost of care. And again, to come back to mothers and wives and those who are caretaking, thinking about whole family care and the health of children over time and the bonds that happen. So yeah, we're really excited about the possibilities of screening and identifying earlier and getting people help quicker.
Absolutely. Wow. I think that is so incredibly powerful. There's so much I could go off of, but I know have so much to ask you. One of the things that I am so curious about, I think, because you are kind of in this role in operations where you're really focusing on the execution as well. One of the things that I'm so interested in is really what it takes, what it means to ensure alignment and buy-in from, all of the team members, all of the folks that you are working with during kind of these change processes. I'm just so intrigued if you have any insights around that.
Yeah, one of the things that's really important is to share the science behind a new technology like we have and help people, partners, individuals being affected by the technology, understand that the technology is real, it works, and thinking about good workflows that assure that everyone has the opportunity to receive help if they need it, whether they're flagged or shown through our technology to have a depression severity score or not. Some people can still benefit from therapy. There's lots of things besides depression that might be going on. So we work a lot around the science and building trust, a lot around communication and workflows to assure that everyone who's using our technology understands some basics about mental health, knows how to offer services, and that there is a way to triage and offer choices to individuals who may need some assistance.
I love that. And I would imagine, I think demystifying, new technology is probably so meaningful and also
Yeah.
kind of creates that like shared language, I would imagine too.
Yes. Yes. Shared language is a really interesting one, actually. It's, depression and anxiety to me as a long-term therapist and provider and expert in this field is like easy language, but it can be really scary and difficult for some people. Thinking about, gosh, do I maybe have depression? Could it be something else? Could I still benefit from therapy or talking to someone, even if I don't have depression? Like these are things that people need time to think about often and really settle with. So we do work on that shared language and those workflows quite a lot. Yeah.
Wow. You just brought up something that kind of sparked for me
Yeah.
around, I think what you were saying really about how I think in like in the quote unquote current state, how the onus really is kind of on you as a patient to kind of identify that maybe you have a problem and kind of touch the system. Whereas kind of the work that Ellipsis Health is doing is flipping that and really making the system more proactive. I'm just so curious because you have such, all of this experience in this space. Are there kind of any other hurdles that you've kind of historically seen that have prevented people from being able to even think that they need mental health care, that they're, worthy of having mental health care?
That's a really good question, Nina. I have so many answers for that. Yeah, I mean, I think people have heard that there's a shortage of mental health providers, so they're worried about raising their hand and saying, I need help because they're not sure if somebody
Mhm.
will be there to help them.
Yeah.
I think that there's still a lot of stigma around mental health. It's
Mhm.
one of the things that I get really excited about around Ellipsis Health, which is the idea that there truly is a vocal biomarker. Something changes with our speech around depression and anxiety. It's not something that's just in your head. It
Mhm.
affects your entire body. It like a disease, like diabetes or like an increased blood pressure. These are real things, and I'm really hopeful that someday that idea and that science helps destigmatize and bring us to a even playing field. I also think that there is a lot of other things that happen. I was just thinking about myself. I've had some not great things happening in the last couple months, and I thought, gosh, do I have depression, or is it one of these other three things? And
Mhm.
I needed some help and to talk to some people and some experts to say, what is it? Let's figure it out.
Yeah.
Either which way, therapy needed to be on the table,
Mhm.
and there's a lot of things that might feel like depression, like grief, like an adjustment to a major life
Mhm.
issue, like birth, like menopause, like all of these things really affect us and our moods and our ability to manage things.
Absolutely. And I would imagine, the power of technology and innovation and kind of all of these amazing things like Ellipsis Health can, really help just be that support structure for maybe those that kind of know that they are struggling and need support, and maybe those that don't, which I think is pretty cool.
Yeah. Yeah. I think there's always a choice. I feel like patient choice, individual choice is hugely important. Informed consent is hugely important. We want to be very thoughtful about all of those key ethical factors. And knowing that you might have something going on that where you could benefit from some extra support gives people a choice where maybe they before they didn't know that they might need that.
Mhm.
I think that that's a really important piece. I don't know how many people go to their doctor and go like, I think I have high blood pressure, right?
Yeah.
Like we don't wait for people to raise their hand on that one. We check it regularly. So it's this idea of bringing mental health into that same fold as physical health and
Mm.
making sure that we're checking regularly and being proactive, as you said. Mhm.
That's amazing. And I'm also so curious because I think, you are sitting in a place where there's just so much innovation that you are doing to provide, for patients, for systems, et cetera. But I would also imagine that kind of fostering a culture of, creativity and innovation and all of that is probably also so important. I'm just, yeah, so curious if that's something that you all are kind of actively looking at, thinking about, kind of that internal culture as well.
Yeah. I love bringing mental health versus mental illness into the workplace. So, one of the things I've been working with our internal team on and with some of our partners is bringing things like resiliency skills to our team at Ellipsis Health. I think that it is a not well known fact that there's 12 resiliency skills that children, adults, anyone can practice on a regular basis that really builds your mental fitness, your emotional health, wellness, and it kind of starts to immunize you towards difficult things that will happen and your
Mm.
ability to manage them better. It's not that you won't get sad or mad or might not still get depressed, but you have skills that you can bring to bear. So I've been in our all hands meetings and other team meetings, teaching resiliency skills and taking time as a team to practice them. One of those things is meditation. I think meditation is popular and not everyone feels like it's for them. And I understand both. And taking a moment in the middle of a really busy workday, and I think this is especially true for women. We tend to multitask and never stop thinking and never stop having that internal conversation with ourselves. And in the middle of our workdays, taking 3 to 5 minutes to have mini mental breaks. There's a ton of research that shows the benefits that not only we individually get from taking those breaks, but also that our work benefits and we are more productive when we take those breaks. So we've been doing some meditations and practicing other resiliency skills, and that's been a lot of fun to bring to the team.
That's amazing. I love that that's something that it seems to be very intentional to foster, this type of working community, this work culture that is really centered around. And I like how you kind of said like mental health and mental fitness. I love that.
Yeah, we've also worked with a group called One Mind at Work, who is really focused on and fostering this idea of mental wellness and paying attention to how we work and work with our employees and our teams. And so, yeah, this idea of taking little breaks and or taking time to share a gratitude with a team member, taking time to think about or share something tough that happened and how you got through it. These are all the kinds of things that reinforce for ourselves how good we are at getting through things and giving ourselves little breaks, which is just hugely important. I think especially with tech teams and healthcare in general, we are always busy and giving and like we have to take care of ourselves first.
100%. I like that. I think that's just a good reminder in general for anyone that's listening that it is okay to take breaks. Make sure that you take one. I love it.
Yeah.
One of the things too, you had kind of mentioned, some of the work that you do kind of in partnership or with other folks. Really would love to learn a little bit more about what that collaboration looks like when you're kind of collaborating with, stakeholders, partners, etc., to kind of create something, have that change initiative. How are you kind of able to bring folks together during that?
Yeah. Well, we've already touched on a couple of them. Good communication, shared language, sharing the science and building trust in the technology are hugely important. As we work with health plans, chronic care management, case management type companies, hospital and outpatient systems, we're also thinking about and talking a lot about levels of care and triage. To go back to something I said earlier, I think some people are a little nervous about raising their hand because therapy might not be for them or that it might not be available. And we work hard to really help everyone we work with, including individuals, again, who are touched by our technology, think about all of the multitude of options that are available today. There are asynchronous chats that you can do that can be helpful. There are online resources where you can learn things like cognitive behavioral therapy tools and apply them to yourselves if you don't want to talk to a therapist. There's so many ways to get assistance. Things like talking to a friend or a pastor can be really amazingly great for your mental health. Seeing your doctor is great. A psychiatrist can be important if you need a specialist. Like that, there is a wide variety of things that are helpful to people. So really thinking about triage and workflow and that there's a lot of choice. I think that's one of the pieces that's hard about mental health. It's like, oh, I'm either mentally unhealthy or great, and I
Mhm.
either need therapy and pills or I don't, when really the truth is there's all these things in between, and there's lots and lots of ways to do little things for yourself. And not everyone needs therapy and many benefit, right? Like all of
Totally.
that's true at the same time.
Definitely.
Yeah.
I love that. One of the things that you had kind of mentioned when speaking a little bit more about Ellipsis and kind of the company is really around like the voice as kind of like a vital sign as well. And I'm so curious, just kind of thinking about voice as this metric, as this measure, when you kind of marry that with the philosophy around kind of total health and holistic health, I would imagine, it's there's probably so many things that you're looking at. So how do you kind of prioritize these multiple objectives to ensure that you do kind of see these successful outcomes when it comes to mental health services and kind of the subset of women, I would imagine as well?
Yeah. Well, I again come back to whole person care and total cost of care, and thinking about wellness, in that we know that when the moms and the wives in the world are well, things go better in the household. They go better
Mhm.
for the kids. We know that when we as women take care of ourselves, we are better. Our moms, mothers, wives, sisters, aunts, whatever we each are to other people, employees.
Yeah.
And so taking that time to take care of ourselves, agreeing on the fact that there is a vital sign and an outcome measure, and that we know that people can be unwell and have depression or anxiety, but they also will get better. People
Mhm.
do get better with treatment and or touches that are positive, like meditations and other things. So I think it's a matter of agreeing on what are the important pieces, and really just coming back to the person is important, and any metric will mental health will show up in. It just will.
100%.
Yeah.
I love that. Thank you so much, Michelle.
Yeah.
We do have some questions from the audience. I want to make sure that we get to that as well.
Yeah, great.
So one of the questions that we had was, are there any questions that you typically get around the privacy of individuals, or have you received any kind of backlash around privacy aspects?
That's a great question. We're really very concerned about privacy. And there are permissions on almost every phone tree, as you think about where we call and what we do. And so people can opt out of being recorded. Absolutely. And I think the other piece about privacy that is really interesting to me is uh, very few people opt out of getting their blood pressure taken at the doctor's office. And
Mhm.
I'm really hopeful that someday we get to the point that very few, if anyone, would opt out of having their mental health vital sign taken, because it's that important, and that destigmatize that it's just a normal part of our routine care.
Mhm.
Uh, so I'm hopeful that we get there, and we take privacy very seriously, and there's always an option to opt out. Yeah.
Amazing. Perfect. And we also had another question that was also around kind of the opt-out, but I think that was answered. So it's really nice that there's kind of, obviously a lot of thought in place to make sure that everyone feels comfortable with things like that.
Yeah. Yeah.
Amazing. Michelle, I have a question for you. We have about 4 minutes. Wanted to see if we had time for a little baby meditation break right here and
Huh.
now.
I'd love to do one if people are up for it. It's the middle of the morning or middle of the day for everyone. So if you're willing to play along, I would
Yes.
ask anyone in the audience who's on the call to take a moment, sit back. I will walk you through this. Get comfortable in your chair. Turn off any notifications if you can. Make sure your feet are touching the floor and your hands are in a comfortable place, and close your eyes. Take a long, slow, deep breath in, and then exhale. As you get ready to take your next breath in, you're going to bring that breath in through your nose and make sure that breath gets all the way down to the bottom of your lungs. Your belly is expanding. Then breathe out through your mouth. As you continue to breathe in, feel your tension melt away. And breathe out. In your next breath in, I want you to breathe in the idea and the feeling of gratitude. Breathe gratitude in, let it come into your lungs. And as you exhale, let go of fear and stress today. Each breath in through your nose is bringing in gratitude. Each breath out is letting go of fear and stress. As you breathe in through your nose and you breathe in that gratitude, think about somebody that you're grateful for in your life. As you think about this person, picture a warm, loving, golden light spreading from your lungs and heart out to where they are in the world. As you breathe out, let that fear and stress go so that nothing but gratitude goes to this person that you're grateful for. In this safe, relaxed state, reflect on all the things that you might be grateful for. You have loved ones, you have the breath in your lungs, you have sunshine, fresh air, whatever comes to your mind. And say thank you to each of those things. We're going to take 2 more breaths, and as you do, you may start to move your fingers and toes or your shoulders. When you're ready, you can open your eyes and come back to the meeting. And hopefully, this very small micro break lets you have a moment for yourself and carry some gratitude forward today. Gratitude is a resilience skill, and it will be really great to make you smile today.
That was incredible. You should have a series on Headspace or something because your voice, just everything about it was amazing. Thank you so much, Michelle.
Thank you. Thank you for doing it, everyone. Yeah. It only takes a couple minutes and you can relax and do something great for yourself. I'm so
That
glad
is,
you all were here.
thank you so much, Michelle. I think I wish all meetings ended like this, honestly. That was amazing. But thank you so much for taking the time to share about your insights and just kind of get us into a nice moment of zen and bliss before kind of our next task today.
Yeah.
So I really appreciate you taking the time to chat with us.
Thank you for having me.